Hello, today we're going to talk about how to research an operational question. My name is Brian Yoon. I am the Vice Chair of Clinical Affairs at Boston Medical Center in the Department of Emergency Medicine. I am an Associate Professor at Boston University School of Medicine, and I have no financial disclosures. Today we're going to learn how to identify mentors and support systems when starting, understand the importance of scope and setting expectations when performing operational research, and finally, be able to identify the steps from idea generation to manuscript publication. So step one is the most important step here, and it's to find the right mentor. Remember, the most successful people don't necessarily make the most successful mentors. A mentor can devote the time and energy, and they have the experience to take a mentee through the process. It's labor intensive, it takes time, and so inquiring and meeting many potential mentors is your best route. Here's a list of potential mentors that you can seek out. Each department, depending on whether it's an academic department or a community department, may or may not have one of these things, these people. So the first is the Vice Chair of Clinical Affairs. At some shops, they call it the Vice Chair of Clinical Operations. This person is responsible for long-term strategy and works with the medical and clinical director to focus on day-to-day operations. They are usually the most senior in the department, and their area of expertise is operations. The next person that you can consider is also operationally focused, and that's the clinical medical director. They do the day-to-day. They may do scheduling. They work very closely with the nursing director, their counterparts in the administrative world, and they also are a key potential mentor. A slight different scope, but still certainly in the operational realm, is the quality and safety director. These areas may be more focused towards traditional measures such as STEMI or stroke or sepsis, but there are a number of fruitful potential operations projects that the quality and safety director may be aware of. There may also just be faculty members that are studying something that is operational. Operational is a big umbrella term, and even a sepsis researcher may be studying something that is very operational, such as time to antibiotics and improving time to antibiotics. That certainly can be an operational project. If one exists in your department, there may be a group of folks who are writing in the area of operations, and they may have formed a group such as an operations research writing group, and inquiring about one or asking to join one will certainly help expose you to additional opportunities for mentorship and for potential projects. The next most important step is scoping out a project. This is not the time to do a randomized controlled trial. Depending in the level or area or year of training, you're going to want to be involved in a project that has an endpoint. And with your mentor, run your ideas through the SMART mnemonic. It should be specific, and by that, be in a area that is within the control of the emergency department. As you tack on interdepartmental type projects, the more complex they can become. And so if your facility has an ED observation unit, then focus on the ED observation unit. If you do not, and it's only the emergency department, then try to pick a project that is primarily centered in the emergency department. Next is it measurable? Is it quantifiable? You can certainly do either a quantitative or qualitative type study, but make sure that you can actually measure. If you don't have an electronic health record and it's all your notes, all the notes are done on paper, that becomes more challenging. If it is done by paper, the ED notes, then is it accessible? Are there time points that are eligible? So again, really making sure that you have the ability to measure the area that you are focusing on. Is it assignable? So make sure that in these projects that you can specify who will do what. And again, projects that are primarily through the department are easier because the people that you interact with are easier to interact and coordinate with. And so make sure that the project can be completed because you have access to and relationships with the people who can give you certain data elements. And then realistic. Most of the time, these projects will be observational or retrospective studies. And with these studies, we need to make sure that it can realistically be achieved. And then time related. These projects really can take about 4 to 6 months to go from idea generation to manuscript completion. And so make sure that the project has an endpoint that is within your own schedule. Step 3 is identifying the data source. Importantly, go through the exercise of defining all your variables and your primary outcome along with your secondary outcomes. When you're thinking about data sources, a common area is, of course, the electronic health record, but there may also be state or federal databases or other hospital or other databases within your hospital that may be accessible. And this is the time to ask your mentor to figure out who has access to what. And then perform institutional IRB training and get access to the IRB portal so that you can write an IRB proposal. And of course, ask your mentor for examples. You do not need to go through this process from scratch. Don't forget with the mentor to establish an author order. Usually the mentee who is doing the substantial amount of analysis and manuscript writing and data collection is the first author, and your mentor in general will be the senior author. As you think about co-authors, these are folks that have perhaps an area of expertise that you will want to bring in to help with your data analysis, help with your manuscript writing. Importantly, keep in mind that equity and representation matters, and by that we want to make sure that experts that throughout the department and perhaps certain people outside the department can contribute, and this includes both gender, sex, race, keeping in mind that having a co-author list of folks with different areas of expertise will make your manuscript stronger and your research project stronger. Finally, determine if a statistician is needed. And this is important earlier on because you'll want to engage the statistician so that as you decide on study design, you'll capture all the data elements that are critical to a well thought out and well designed and conducted study. Step 4 is an important step that will help get your thoughts onto paper and allows you to make sure that you're on the same page with your mentor. This is called the 0th draft. When you're thinking about the draft, you can start with the title, and this is an operational research, and so make sure that it captures an operational theme. That'll be important certainly as you think about promotions. And so in operations, we think about throughput, we think about utilization in addition to process improvements. And so making sure that the title includes these key terms will be helpful in your academic promotion, but also making sure that you are focused in the reason why you're doing this research project in the first place. Remember, a manuscript is a story, and telling one clear story is better than trying to fit multiple intertwined stories. There's clarity in one central story with one primary outcome, and certainly this is not to discourage secondary outcomes, but just remind yourself what is the story that you would like to investigate and tell. And this zeroth draft, oftentimes 80% of the manuscript can be written, of course, except the results and the parts for the discussion, but you'll be well on your way after you complete your zeroth draft. Step 5 is, once you have the data, is to analyze the data, and part of this is doing chart reviews, especially if you're trying to understand variables that are not easily attainable through the electronic health record. Bring in a medical student or co-resident to help with this component. And then, as we had done earlier on with the statistician, start working out what are the stats that you're going to run the covariables and the outcome through, so that you can also be on the same page in terms of your results and discussion. Step 6 is completing the manuscript. This is where, once you have taken the zeroth draft to a first draft, you'll send it to your senior author, your mentor oftentimes, for review and edits. And at that point in time, you will also likely identify the initial journal and a backup journal in case the initial journal rejects your manuscript. In the initial submission journal format, send to your co-authors for review and edits, and establish a due date, usually 2 weeks. It's important to establish a firm due date so that expectations are set. And once you get all the edits, combine them and send the manuscript to the whole group for final comments and edits, and you usually give people another 3 to 5 days to give final comments. Other advice is, when you are doing and completing the manuscript, don't be the bottleneck. Importantly, as I mentioned, your mentor and mentee relationship, it's a lot of time and energy that is being focused in there, and so you don't want to be the source of why things aren't moving to the next step. Understand and be aware of landmines. So certain areas of research and focus, depending on if you're an academic medical center, may be in the area of focus for another researcher, and that could lead to, unfortunately, some hurt feelings or feelings of ownership. And this is where your mentor will be helpful in helping you navigate what the landmines are. Remember, rejection is not failure. When a journal rejects your manuscript, read through the comments and suggestions. They can make your manuscript even stronger, and your subsequent submission to a journal will be even better. Thank you for listening, and I wish you best of luck on your journey on doing operations research.